Good afternoon. Thank you so much for taking the time to attend this webinar today. As Erin had said, this presentation is called Talk Saves Lives, and it really is a general introduction to suicide prevention. I understand that you are all HR professionals, so this is something that I think will be beneficial to you, and it is also something that you may want to think about presenting to employees in your organization. So we can talk later about the different types of trainings that are available after this, but this is our introduction to suicide prevention, and I hope that we're able to give you an overview of why we feel it's so important. So my name is Ann Morrison, and I am the Area Director for the Long Island chapter of the American Foundation for Suicide Prevention. Again, thank you for joining us today. So we're going to go through this. There's a lot of information, and as Erin said, if you can type your questions, if you have any, we'll be happy to answer them as we go through. I am just going to go through the presentation and go through the information for you, and look forward to talking to you at the end. No. I'm sorry, just a little technical.
You're good. Sorry, everyone. Technical difficulty. Now try.
Okay. Suicide is a very complex health issue. But despite its complexity, suicide is preventable. Just like there are warning signs and risk factors for other health crises like cardiac arrest, we can learn the warning signs and risk factors that help us to prevent people from dying by suicide. And just like other health issues, time can be a very critical life-saving measure. Typically, a life may be saved if you allow time for the person's suicide risk to subside or to get through that period of distress so that you can get them the mental health help they need. So to prevent suicide, we need to identify persons who may be suicidal, as well as take an active role in connecting them to the help they need before they take action to end their lives. So today we're going to cover some statistics to give you an idea of the scope of the problem of suicide. We'll go over some of the research findings, including the risk and protective factors that relate to suicide. And we'll talk about what works and what we can all do to prevent this leading cause of death. So let's start with some statistics to demonstrate the scope of the problem. Suicide is a global problem. Worldwide, over 800,000 people die by suicide each year. And according to the World Health Organization, that's a conservative number, since some countries don't accurately report suicide. That works out to about a suicide every 40 seconds worldwide. And in the United States, suicide is the 10th leading cause of death. And for Americans aged 10 to 44, it's the second leading cause of death. Suicide takes more lives in the United States than homicide, war, and natural disasters combined. So in 2015, which is the latest year we have data for, over 44,000 people died by suicide. And for every death by suicide, it's estimated that 25 others actually attempt suicide. So that's 1 million Americans each year who survive a suicide attempt. It is estimated that the majority of Americans who experience will experience a suicide loss over the course of their lifetime. And loss survivors are profoundly impacted. Losing someone by suicide will affect you for the rest of your life. And AFSP has resources for those who are grieving of suicide, and we have ways that we reach out to families to help them and support them during that time. In addition to the devastating toll on families and communities, emotionally and socially, there's a fiscal impact on our society as well. The Centers for Disease Control and Prevention estimate that in the year 2015, suicide cost the United States $51 billion, costs due primarily to lost wages and productivity. That's a lot of money that companies are spending for people being out of work for either absenteeism, for depression-related illnesses. Okay, so let's move on to research. It's only been in the last few decades, really, that scientists have been studying suicide. Research is shedding light on many critical areas, but we still have so much more to learn. Here are some critical research findings. One of the big questions research explores is, why do people take their own lives? There really is no single cause. Suicide most often occurs when several stressors and health issues converge to create an experience of hopelessness and despair. Research has consistently shown that 9 out of 10 people who die by suicide have a mental health condition at the time of their death. It may or may not have been diagnosed or adequately treated. But mental health conditions are not the only thing that contributes to suicide. Mental health conditions can't be the whole story because mental health conditions are common, and the majority of people who suffer from these illnesses don't die by suicide. But there are other factors that increase the risk as well. We've learned that the brains of people who die by suicide differ from those who die from other causes in terms of structure and function, specifically in the areas related to stress response and impulse control. We've learned that most people who try to kill themselves are ambivalent about death. Part of them wants to live, part of them wants to die. So a key strategy in suicide prevention involves engaging the part of the person that wants to stay alive and helping to create distance from the part of them that wants to die. So one way we do that is to help the person connect with reasons for living, while at the same time decreasing the visibility and presence of things around them that may want to facilitate their desire to die. We've learned about the perspective of a suicidal person, that a crisis point has been reached, that the pain seems unbearable, whether it's emotional pain, physical pain, or sometimes it's both. So for a moment, I'd like you to think back to the most painful thing that you ever experienced. Maybe it was childbirth, a broken bone, passing a kidney stone, something that was very, very painful. And at that moment, would you have been able to give someone clear and accurate directions to your house? Probably not, because the pain was overpowering your mind's desire to be able to give those clear information. The unbearable pain makes something that ordinary, in ordinary thinking, almost impossible. For a suicidal person, thinking becomes limited at that moment of crisis. It's a state of intense tunnel vision where no other options seem available. So it's important to remember that suicidal feelings are often temporary. So they can come on intensely, and they can sometimes pass in minutes or hours. So keeping people safe and making them feel supported can get them through those critical moments and can save a life. There's evidence that putting time and distance between someone who's suicidal and the means to take their life can be a life-saving action. That's why it's so important that we take steps when we know someone is struggling to help keep them safe. So looking into the future, research will help us to find the best ways to fight suicide. Research has been looking for biomarkers, something that might be testable in a blood sample that would help to identify someone that might be at risk. There's been a number of clinical treatments, particular types of therapy that have been effective for suicidal people, and more need to be developed and studied. The good news is that through research, we are learning more and more about what helps those who are in a suicidal crisis. Research can also help to identify the most effective interventions to reduce suicide rates and to reduce risk in those suffering from mental health conditions. Research has also helped us determine the factors that increase the risk for suicide. Who is at risk? Risk factors are characteristic or conditions that increase the chance that a person may take their life. Just like someone may be at risk for heart disease because they have high blood pressure or have a history of heart disease in the family, some people are at higher risk for suicide than others. The main risk factors are grouped into three categories. Health factors, including biological and physiological aspects of a person's health. Historical factors, or things that happened in the person's past or their family history. And environmental factors, including societal and cultural factors. Access to means, and access to means as well as individuals' life events, something that may happen in their life. So sometimes these risk factors collide at different times in life and increase a person's risk for suicidal behavior at particular points in time. So let's take a look at that a little closer. Health factors include medical conditions, so health factors that increase a person's risk. The most significant of those conditions are mental health conditions. As we said before, 9 out of 10 people who die by suicide have an active mental health problem at the time of their death, sometimes multiple risk factors. Depression is by far the most common mental health condition and the one that is most commonly found as a risk to suicide. Bipolar is also high risk, but that disorder is less common than depression. But all of these conditions put a person at greater risk for suicide. So detecting the presence of a mental health condition is critically important. The best way to be sure is to seek professional evaluation and effective treatment when you feel concerned or detect a possible change in someone's overall mental health. Not only can you reduce the risk of suicide, but you can increase a person's well-being and their life functioning can be improved. So really reaching out and getting that mental health diagnosis done. Many people don't realize that their distress has actually become a health problem. They don't see it, but others will. Providing them information, such as a crisis number or a mental health resource to someone who's struggling, can be a really solid step in getting them to connect to the help that they need. Mental health conditions are not the only factors that are associated with suicide risk, though. Serious or chronic health conditions like diabetes can increase risk, especially when someone also has a mental health problem. Serious or chronic pain can increase a person's suicidal risk, and we've learned that a serious head injury, like a concussion at some point in someone's life, can also increase their risk for suicide. And we talked before about historical factors. Historical factors include past events like a family history of suicide, a family history of mental health conditions, or past trauma like sexual abuse or combat stress. And while most people who attempt suicide do not go on to die by suicide, a previous attempt, someone who has previously attempted suicide, also puts a person at increased risk for them to try again. Being abused as a child can also contribute to a suicide risk. And we mentioned environmental factors involving the circumstances of a person's life. Often there are layers of a person's environment that contribute to their overall level of risk. Let's take a look at a few of the most common of these. Contagion can include exposure to another person's suicide, or to graphic or sensationalized accounts of suicide, which is why it's so important that we train the media on how they are reporting suicides, because the contagion effect is very high for people who may be at risk. Prolonged stress, that includes harassment, bullying, relationship problems, legal problems, unemployment, stressful life events, like a divorce, legal problems, or losing your jobs. And having access to a way of killing oneself is referred to access to lethal means. So that includes having access to a variety of things, such as firearms. Somebody who owns a gun has access to means. Somebody with access to drugs, a bridge, a car, those are all access to lethal means if somebody is at risk for suicide. So here's an example of a set of risk factors that can converge in a person who is suicidal. One problem with the public perception of suicide is that when someone dies by suicide, often the story only talks about the environmental factor. They see a life event like a breakup or bullying or job loss. Then they see that the person died by suicide. So they might assume the person killed themselves because of that stressful life event. But that's never really the full story. What others don't know is that the person who died may have had genetic risks for suicide. Maybe they were suffering from depression and anxiety disorders, and their work life had become increasingly stressful. Their underlying depression and anxiety could have made the situation at work even worse, or the work stress could have made the depression worse. Maybe they were drinking more than normal. The key is that all of these factors in combination could have contributed to the suicide. It was not just one event that caused that to happen. So the life event can play a precipitating role for suicide behavior, but without the other underlying risk, they aren't thought to cause suicide on their own. So during the times of higher suicide risk, it's very important to put time and distance between a person and their way of ending their life. If they're unable to access their chosen method, even temporarily, they're unlikely to engage in other behavior to end their lives. So that leads us to talking about prevention. How can we prevent somebody from taking their life? We know that there are protective factors that lower a person's risk for suicide. If you are proactive about mental health and make an effort to get healthier, you can protect yourself. Feeling connected to family and community and your coworkers can protect against suicide. When somebody is struggling with depression, anxiety, psychosis, substance abuse, these protective factors that normally can be strong can erode and weaken. When that happens, having friends and family to remind us of our strength can be a tremendous protective factor. Teaching people problem-solving skills also helps. Life can get really tough, but being able to see a way through problems can be a protective factor. So teaching people how to work through their problems. And we know that cultural and religious beliefs can also help people get a strong sense of purpose and can be a protective factor. We know that the most important thing you can put between a suicidal person and their way of ending their life is time. Research shows us that by temporarily reducing a suicidal person's access to lethal means, we can give suicide individuals time. Time for the intense suicidal risk to diminish, and time for someone to intervene with mental health support and resources. And we know in most cases when a suicidal person doesn't have that current access to the means that has been on their mind, what they've been thinking of doing, they don't substitute it with another method. So if we can take those means away and give that person time to let those suicidal thoughts subside, we can reduce that risk that they were going to have to take their life. Getting effective treatment for depression or anxiety can prevent suicide. Mental health should be treated like any other aspect of a person's health. Just like we talk about keeping ourselves physically fit, we need to be able to keep ourselves mentally fit. And there are certain times when you get sick and it's critical to seek a trained professional. The same holds true with your mental health. So one of the biggest challenges we have in fighting suicide is getting people to treat their illness. Of those suffering from a mental health condition, less than half seek treatment. Only 2 in 5 people with a mental health condition seek treatment. We need to make sure that we cultivate a culture where everyone knows it's smart to take care of their mental health. Taking care of mental health, as I said before, is just as important as physical health. Seeking a mental health professional is a sign of strength, not weakness, as many people may think. requesting a thorough evaluation to figure out why and how this mental health condition is affecting your life. And understand that there are many types of treatments available, different types of medications, different types of therapy, and we know that for many people, the combination of therapy and medications are the most helpful and can help them live a normal and productive life. We need to be proactive with self-care strategies, making sure that we have good sleep habits, that we exercise, nutrition, stress management, all things we normally think about when we're talking about our physical health, but also will promote mental health and resilience. We need to be proactive with our self-care strategy. Oh, I said that. Sorry. And as we already mentioned, a clear way to prevent suicide is to limit the access to lethal means. And this can be as simple as installing an inexpensive carbon monoxide sensor in a car that would automatically shut cars off if carbon monoxide levels reach unsafe. We've learned through research that installing barriers on bridges deters suicides in many studies, and it actually lowered suicide rate for an entire region. Restricting access to potentially lethal medications reduces suicides. And it could be as simple as requiring drugs to be sold in blister packaging, so they're harder to open. And firearm safety is so important. In the United States, firearms are used in over half of all suicides. And making suicide prevention a part of gun safety education can reduce suicide rates. And that's something that our organization has been working very closely with gun associations to educate gun owners on how to keep those firearms safe should somebody be having a mental health crisis. And contrary to what you may think, most people who are suicidal do not find other means, and suicides just never occur at that moment. So we know it's so important to limit the access to means. And we also know that we need to provide support for those who are touched by suicide. The loss of one person to suicide profoundly impacts so many people. And it's important that survivors have the support they need both to heal and to reduce their own risk for suicide. And since those with lived experience, those who have attempted suicide or experience suicidal thinking, are at an increased risk, we need to make sure that they have the support that they need too. So what can you do to prevent suicide? The first and most important thing is to have a conversation with a person, to allow them to share what they are experiencing. This not only shows that you care, but it allows you to gain more information about their level of distress. There's warning signs that we can watch out for in other people and in ourselves. Reach out to the individuals you're concerned about, and reach out to other people if you're struggling yourself. Seek mental health services if you're depressed or if anxiety regularly interferes with daily life, and encourage others to do the same. And we mentioned that before, getting the mental health help that you need. Reaching out for that help is so very important. We also have learned that there are warning signs, just like we talked before, there were warning signs for heart attacks. There are warning signs for somebody who may be at suicide risk. And they're typically shown in three ways: talk, behavior, and mood. So many people who are suicidal talk about it in their lives, either directly or indirectly. They might say it outright, or they might joke about it. It should always be taken seriously. They may say things that are a little bit more subtle, like, I really have no reason to live, or that they are a burden to others. I don't like being a burden to others. They may talk about feeling trapped. They may talk about feeling overwhelmed or being in unbearable pain. People thinking about suicide also display certain behaviors. you may start seeing an increase in the use of alcohol or drugs, or somebody's telling you they're seeing an increase of somebody using that. They might talk about having trouble sleeping. They might start acting more recklessly, taking more risks. They might withdraw from activities, ones that they normally enjoy doing. They might start isolating themselves from family and friends. They might start looking for ways to take their lives. They might start searching online or looking for a firearm. They also might start giving away possessions, some of their prized possessions. People at risk for suicide display, and often it's very subtle, any of the following moods: depression, apathy, rage, irritability, impulsivity, humiliation, anxiety, moods one would expect of someone who feels overwhelmed and desperate. We all have ups and downs, but when you notice a change in someone that seems uncharacteristic or concerning, it's important to speak to the person about what you're noticing. And that it's a lot of things to look for, but really the simplest things that I always tell people is to trust your gut. If you are thinking that somebody is in crisis or maybe having a problem, assume that you're the only person that's going to reach out to them. Don't assume that somebody else has already talked to them, somebody else is asking them. In too many cases, people talked about being concerned about somebody, but then they didn't reach out to help that person. So the rule of thumb is if you're wondering if someone's depressed or overly anxious, it's a sure sign that means you should really ask them about it. And if you've reached out to someone before, but you're still seeing the same types of behaviors and talks and moods, reach out again. Keep trying. Try talking to that person and ask them to talk to a professional. Because we know that talking absolutely saves lives. It's really simple, but it works. And even if you're wrong about someone's risk of suicide, they might still be in distress, and they will feel comforted and supported just by knowing you care and took the time to listen. Or they may need someone to give them permission to seek help. They've been really waiting for someone to ask them if they're okay. So how do you reach out to someone who you think might be in a crisis? Talk to them in private, obviously. Listen to their story. Express concern and caring. Ask them why, I've noticed there's something wrong. Is everything okay? And if you really suspect that they might be having suicidal thoughts, ask them directly about suicide. Encourage them to speak with a counselor here at EAP. That's what they want to do. Encourage them to seek mental health services. Avoid minimizing their feelings. Those of us who have never experienced major depression literally cannot imagine what it feels like. Avoid trying to convince them that life is worth living. If a person's in a near crisis, they're not thinking clearly. So debating about life being worth living really tends not to be helpful. And avoid advice to fix it. If a person's having a heart attack, you wouldn't tell them to start exercising to get healthier and diet. They're already having a heart attack. So if they're in crisis, what they need is to be heard and then led to help. Listen to their story. Offer to help them find a health professional. Offer to have them call the EAP counselor. Help them take active steps towards keeping their environment safe. And if you think they might make an attempt on their life soon, stay with them. Don't leave them alone. Help secure lethal means or remove them from a dangerous situation. Get them to a mental health services or an emergency room. This number is the National Suicide Prevention Lifeline, and it's staffed 24 hours a day with trained counselors that can help help you, actually. You can call that number. It would help you tell someone what to do and get them to the help they need. It's a national line with calls going to local trained representatives. So a lot of the times we will tell people, if you're not sure if the person's at suicide risk, you can call this number and talk to a counselor, and they can walk you through it. And it absolutely is a number that we give to somebody who may be experiencing a crisis, because those people know exactly the questions to ask and what to do and where the help is needed to get them to. And obviously, if it's an emergency, you would call 911. But the main point of all of this is that if we can create a culture that's smart about mental health, we can help prevent suicide. So that's the formal part of the presentation. How do we
Yeah, so thank you so much, Anne, for sharing that. And we do have a few minutes, so if anyone is interested or has a question, goodness gracious, our technology is not working here. You can feel free to type a question either into the question box or the chat. Or if afterwards, if anyone has any questions, you can always contact me, Erin McCowan, the Senior Client Consultant at National EAP, or you can contact Anne directly. We certainly would love to speak with you if you have any questions. And also for your own information going forward, as Anne mentioned, you can always reach out to the crisis support line if you are concerned about yourself or an employee who may be having some issues, but you can also reach out to National EAP as well. We are all licensed clinicians who would be more than happy to talk to you about how to handle a situation. All right, I'm not seeing any questions come through. So if no one has any questions, then we thank you all for attending. And Anne, thank you so much for sharing this information with us. And we will see you all next time. Thank you so much.